Assalamu alaikum. Now I would like to talk about lumbosacral radiculopathy. In lumbosacral radiculopathy, what happens in the lumbosacral radiculopathy? Reflex affected L2 to L4. Reflex affected. First of all, in lumbosacral radiculopathy, nerve root L2 to L4. Reflex affected is patellar, and sensory loss there is anteromedial thigh and medial shin, and as the myotum regards that means there is weakness in the hip flexion, that means iliopsoas muscle is problematic. There is a abduction hip adduction and knee extension. So three things: hip flexion, knee extension and hip adduction. This is all about L2 to L4, and in L5 there is uh, no reflex affected, and sensory loss is lateral shin and dorsum of the foot. Lateral shin and dorsum of the foot. And we know that peroneus, everse, and dorsiflex. So these type of muscles is get weakness. Peroneal eversion and dorsiflexion, foot eversion, dorsiflexion. That means tibialis anterior, and foot eversion. That means peroneus and toe extension, that means extensor hallucis and digitorum, extensor hallucis and digitorum. In S1 there is Achilles reflex is lost. In S1 radiculopathy, Achilles reflex is affected. So posterior calf and sole and lateral foot, posterior calf, sole and lateral foot. In here there is hip extension, that means gluteus maximus, and knee flexion, that means hamstring, and foot plantar flexion is involved. Foot plantar flexion, that means gastrocnemius is involved. In S2 to S4, like in here there is anocutaneous reflex is affected, sensory loss is perineum, and weakness is urinary and fecal incontinence and sexual dysfunction. That's all about. Hope you enjoyed.